Good afternoon, class. Today's discussion will focus on the 2008 UCLA medical records breach. The question before us today is, how do we properly train and educate our staff to ensure accountability and protection of patient information? First, let's get a little understanding of patient rights and the confidentiality of care. It is undoubtedly our responsibility to ensure that the patient's care and corresponding medical records are safeguarded to ensure confidentiality of patient information. There are two programs that we must be compliant with: HIPAA and HITECH. HIPAA stands for the Health Insurance Portability and Accountability Act, and HITECH stands for Health Information Technology for Economic and Clinical Health Acts. As you have all read, in 2008 it was discovered that between 2004 and 2006, nearly 120 employees inappropriately viewed medical records at the UCLA Medical Center. What exactly does this mean? And what exactly is an electronic medical record? So let's first understand what an EMR is. An EMR is an inclusive medical documentation system. From the moment a patient walks into the emergency room till discharge. So that means that the admissions, the patient's history, the assessment, the physician orders, the daily assessments during inpatient care, plans of care, and discharge planning are all included in a one-stop shop electronic medical record. So this means that a lot of people have access to an EMR. Nurses, techs, physicians, physician assistants, social workers, everybody has their part in the system. Oh, and let's not forget finance. With every patient comes the payment. We've all received that. This is not a bill. So what happens when there's an unauthorized disclosure of patient information? It depends on the hospital. Most hospitals assume that any type of inappropriate keystroke is considered to be a breach and should be investigated to ensure compliance. Depending on the computer systems or the medical institution, most EMRs provide an extensive tracking for keystrokes and alert system so that supervisors and managers can properly maintain compliance and ensure that if you are a health worker, you are only accessing information for patient records. Or if you work in finance, you are only looking at the patient's financial records. So how do we teach people and how do we train people? The important thing to start off with is communication. We have to, in order to have effective communication, we have to create a policy and a procedure to explain the purpose of why we are creating the document, why we need to protect the data, and then we need to explain the impact to the employee, the impact to the hospital. So let's start with an overview of the purpose. The goal is to prevent improper use and disclosure. So this policy would explain that because of the requirements of HIPAA and HITECH, that we protect the patient's information, that the policy is being created for that purpose. The impact will be that we are protecting our patient's privacy, medical identity theft, reputation and financial harm, and also loss of dignity, which is very important to remember. There are a lot of folks in the world that don't want their information released to the public, and we need to respect and understand that. And then in addition to staff responsibilities. At the end of the day, it's everyone's responsibility to protect the privacy of our patients' health information. And we should not in any way view or disclose protected health information without an appropriate business need. So therefore, we must have effective policies and security to ensure compliance. So how do we manage compliance and how do we teach the team? In most organizations, there are training seminars on a regular basis. Where I work, we have Patient-Centered Fridays. So every single Friday, all of the salaried staff members meet in the auditorium, and there are topics of the day. So this, for instance, would be a topic of the day. Training material would be provided to those supervisors and managers, and they would take this information back to their team and have individual huddles to help explain and ensure compliance and understanding of what is expected of an employee using the EMR system. Let's talk about compliance. If there is a violation, or if there is perceived to be a violation, how do employees report it? How do they not get caught up in the drama? And what happens? How is it investigated? In our organization, we have a system called KeepSafe. So if I witness or if I believe that John, the nurse, has inappropriately entered Professor Rutledge's medical record, we can then file a KeepSafe report anonymously and simply state, in conversation with John, he admitted to entering into Professor Rutledge's medical record, and he admitted that the professor was not his patient. From this point, depending on the institution, that data would be sent typically to a privacy officer, and that privacy officer would review the statement, would then pull reports from the EMR system, reviewing John's keystrokes. We all know a lot of times people just talk to talk. So by taking this step, they could investigate, did John really enter the document, and were his actions appropriate or inappropriate? Furthermore, perhaps maybe he had permission to enter the document to enter, let's say, an updated blood pressure, but he did not have permission to enter the financial section of the EMR and review Professor Rutledge's Social Security number. I mean, we all want a nice fancy car, but we must protect our patients' privacy. So with that being said, the investigation could continue, and disciplinary processes have been set up and are typically in a progressive format. However, because of the severity and the financial impact and reputable harm to the organization, many times there is a zero-tolerance policy. If you are found to be violating the policy, it can be a very swift road to termination. And in many instances, it is simply necessary to protect the patient's rights and the organization. I look forward to receiving your questions and comments, and I hope that I was able to answer your questions. Thank you.